don't worry, this is just an exercise and it's a learning experience, so you don't need to be nervous. It doesn't matter if you do something wrong. We can discuss that. We can reflect on it later. So just try to relax and sort of get into the situation and think that this is a safe environment, that we won't spread anything outside the classroom that happens today, so that you can feel okay.
Yes.
So yes,
I feel better now.
I think you'll do fine, and if there's something goes wrong, then we'll discuss it. No problem.
Yes.
So today the theme of this simulation is about, it's not on my scenario, but it's about a patient with COPD, and the learning skills are about communicate. You've seen them on the prepared them, and you know, so they're about communication and interaction methods to ensure that patients, users, and relatives' participation and autonomy are taken care of on all levels. And it's also to have a deep, in-depth knowledge of patients, users, and relatives' possible reactions and needs according to age, gender, social, and multicultural perspective. And it's also another one is to apply knowledge and skills to lead and work effectively in a team, have good understanding of the limits of your own competence, as well as insight into competences of other professionals, and when these professionals should be involved. Also to identify, assess, and analyze signs of changes in the patient's, the user's health status, and do quality assessments, conduct professional reasoning in the assessment of the health status, and implement relevant measures. And also to implement systematic, professionally relevant examinations and assess the patient's health status. And you can recognize pedagogical principles to guide and teach staff in complex patient-user situations. Perhaps not all of these you will be able to use, but this is the learning outcomes. Do you understand it? Is anything unclear?
Yes.
No, you know what's about that. And so, should I tell them the case now before they go out?
Yeah.
So they can think about a little bit about the case. So,
Yes.
so we're going to have, Petra is going to be playing a patient, and she will be a patient, Beate Jansson, who's 75 years old, who's living in a nursing home. She has COPD.
So we get the case and then we go out.
Yeah.
Okay. Yes.
And then you can talk a little bit about and discuss before you come in again. She lives in a nursing home. She has COPD grade 3 and is in need of care due to the fact that she also has multiple sclerosis. This is 4 weeks since you last met Beata. Others have, over several days, she has developed more troubled respiration and breathing. She has again 22 respirations a minute. Her oxygen saturation level is measured to 92%, which is her habitual value. Otherwise stable parameters. You come into Beata in the morning to look after her and to arrange for care. So that's the scenario. So now you can go out and discuss a little together, and we'll have a short briefing here, and I'll ask you back in a few minutes. Yeah. You're lying, sitting sunk in bed in the room. You're freezing and shaking and trembling a little, and ask about receiving an extra blanket. Simultaneously, it's difficult to breathe and you want more air, and wish that they open the window. The staff will realize that you're having heavy breathing and have difficulty with speaking in whole sentences. And you're anxious. If they do not initiate the correct treatment, you will gradually become increasingly worse in your breathing. Proper treatment is to sit yourself up in bed, measure oxygen saturation, and gradually administer oxygen gradually to 10 liters by mask. You become better in a short period of time, but due to your CPOD, you will eventually retain carbon dioxide, gradually become lethargic, and go into carbon dioxide narcosis. When this happens, they should recognize that you gradually become lethargic, continue to maintain free airways, possibly use a pocket mask, and get more help. It ends with the patient being admitted to the hospital. So that's try to remember what you're going to do. So if you get in bed and prepare yourself, I'll let the students in.
You start now?
We have to let the students
Okay,
in.
thank you.
Beata's waiting in her room.
Yes.
So you can stay for a minute and we'll say, okay, you can begin now.
Okay. Hello, Beata. Nice to meet you. My name is Johanna and I'm a nurse.
My name is Frida. I'm a nurse assistant.
Sasa.
How are you doing?
Are you difficult breathing? I cannot open.
Okay, let's see how to make it better. No, no, no. Can I put your back? Okay. You try to pull up a little bit. Bend your legs, please. Okay. You try to pull the sled up. Are you comfortable for this one, you said? Okay. Oh, okay. Interesting. You know how to put the bed up?
We've said that.
Maybe here. Okay. Okay, sorry. Okay, so you're feeling trouble breathing? Yeah. No slime? No? Can I just check the airway? Yeah? Nothing? Okay, so it's clear? Yes. So should we
Breathe.
you cannot breathe. Okay, we'll help you soon. Okay, Rita? Yes. Should we take a finger? Yeah. Can you pass me the blood pressure thing? We're here with you all the time. Please. Okay. So what are the measurements that you are getting? I don't hold your hand here. Sorry, I can. No, for the blue one. Yes. There we go. You feeling any better? With the head raised? So what is the what do we have here on this? Do we get what kind of values do we get? Yes.
It doesn't say in my script. I think the blood pressure is.
We can wait until we get the value.
Oh, blood pressure.
Oh, okay. That is fine.
Okay, so
Just the blood pressure.
yes. So we have an
Here it is.
SpO2 on 92.
The blood pressure is 170 over 90,
Yes. So we have the saturation on 92.
and saturation is it's gone down to 85.
It's gone down to 85.
Yes,
Okay.
and the respiration rate is 27.
Okay. So maybe we could
So it's gone from
Sesak lah.
92 to
try to stay
85.
calm.
Sesak sikit lagi.
Help you.
Mhm.
Yeah. So we have a good airway and we have difficulty breathing and then enhanced low saturation. Okay. And also a high frequency of breathing. Okay, maybe yes. Turn it on. Okay. And put in, sorry, 1 meter. I'm going to good pulsations.
Pulse 120.
Yeah. So high pulse.
Myopdi, myopler.
Yes. No stress. Maybe we should call the doctor, because when we put on oxygen, and that's really the doctor something to order in Sweden at least. Okay. Yeah. So should we do that? Perhaps. Okay. So should we also get a temperature before calling? Look at your legs and feet. Okay, I feel your legs. Yeah.
So you need it? You saw?
Okay, just
It's over.
Time is over.
okay.
Okay.
I have time to call the doctor.
But then you, as fast later.
Ring ring.
Hello, this is Dr. Nelson.
Okay, this is Nurse Johanna
Mhm.
calling. We're visiting the name that I don't remember, and she's a 75-year-old person with COPD stage 3, and we're here, and she's not feeling well. She has trouble breathing, and so we have examined her, and I think that we have actually put on some oxygen, because her saturation was low, her breathing frequency was high, and she had a high pulse and a low blood pressure. No, the blood pressure was also high, sorry. And she's not feeling too well, and the temperature is...
How is her alertness?
Oh, she has trouble speaking to us, but she's alert.
Mhm.
I think.
And what
Tired.
what was the temperature, did you say?
No, I didn't hear that. 39.2. Sorry.
Yes, I think it sounds like she needs some more medical examinations. So I think you can call an ambulance.
Okay, I'll do that.
Mhm.
Thank you. And
Ah,